Thank you for listening to Plastic Surgery Secrets Talk, the podcast where we go over all the latest and greatest things, all the secrets that are coming in plastic surgery and facial plastic surgery and looking your best with the experts of the field. And I'm Dr. Jeffrey Spiegel from Boston with the Spiegel Center. I'm so happy to have with me today from Chernoff Plastic Surgery in Indiana and California, 2 locations. And I was just hearing about what a huge operation this is, Dr. Gregory Chernoff.
As with you, after 30 years, I'm still blessed. I love every day. I think we have one of the best jobs in the world, and the technological advancements that we see continue to rise exponentially, which really keeps every day fascinating for us.
Well, that is the perfect segue, as they say in media, to what we want to talk about, which is Dr. Chernoff is a leader in wound regeneration, skincare, and sort of what's going to happen in the future with keeping us looking good on the cellular level. Can you tell us a bit about that?
So for the last 30 years, I've been involved in the research involving cellular medicine, regenerative, and stem cell therapies. And we've come such a long way. When I used to talk about this on podiums 30 years ago, people in the audience would look at me wondering what galaxy I was from.
They couldn't check their phones at that time.
And now they just look at me wondering what planet I'm from.
Yeah.
So we've come,
well, at least
we've come
you're in
a
the
long
solar
way.
system.
That's right. We've come a long way. We started 30 years ago with injectable fibroblast therapy. That had some downfalls. It took 6 months to grow a minimum concentration of fibroblasts required to achieve a clinical result. So then we graduated. Autologous was always on the minds of patients. So then we started looking at autologous fat-derived mesenchymal stem cells.
I remember that.
Our fat has. Our bone marrow has about 80,000 stem cells per mil. Our fat has about 1.5 million. It hurts. It hurts to get a bone marrow biopsy. You and I harvesting 100 cc's of fat under local anesthetic is pretty innocuous.
No big deal.
So we came a long way. Then I'm continue to be a member of the Cell Surgical Society that Mark Berman and Elliot Lander started in California. That was not FDA approved. I knew that the FDA was starting to look closer at that. So I started to look then for an off-the-shelf form of cellular medicine. And that's when I met Dr. Duncan Ross as the Chief Scientific Officer and CEO of Chimera Labs here in Miami. And so we've been working with them now for over 6 years. We have arguably one of the largest series in the world. We're well over 700 patients now.
That's probably the largest. And what does it do? If I'm a patient, what can I get from this?
So mesenchymal stem cell derived exosomes are like shiploads of containers packed with growth factors. So in adhering, the FDA came out with a position June of 21, because none of these companies have FDA approval currently. Chimera just received an IND for a phase 1 study looking at intravenous utilization. For now, we can make no claims other than topical application for the beautification of skin.
That's the official. But what do you think, and what are you seeing?
So prior to that, the benefit of chimera exosomes is they come to us sterile. So they are placental derived. So from one C-section donated healthy placenta that then they checked for everything bad known to mankind. They now have a master cell line that they can tissue culture mesenchymal stem cells. And then from the petri dishes that they culture the stem cells, that's where they gather these beautiful little particles called exosomes. So we, in our study, we've looked at aging skin, acne, alopecia, wound healing, and scar therapy.
All the things we see all the time that people
every day
can't stand and need to fix.
Right. So it really just, it is a topical application that with proper homing, exosomes have a very strong anti-inflammatory, immunomodulatory, regenerative, and an anti-prostaglandin effect. Prior to the FDA's position, we were looking at we did multiple studies, split-face, double-blinded, saline, placebo-controlled, where we were flooding topically our facelift wound beds, our abdominoplasties, our brachioplasties. Those patients weren't requiring any pain medication afterwards.
That's amazing.
And they were just getting a better result faster.
So they're healing faster with fewer inflammatory issues. Correct. So they're not having pain. How about scarring?
As I mentioned, we're approaching the axolotl salamander as a salamander that has a scarless healing capability. You can take a punch biopsy from a salamander, and by day 90, it's healed with no scar. When you look at the wound healing parameter, the salamander has rapid hemostasis, next to no inflammation, and very fast regeneration. And that's really what we're seeing with exosomes in
When do
wound
you
healing as well.
expect this to be widely understood, available, and with good, reliable treatment protocols?
We have good, reliable treatment protocols now. The companies need to get FDA approval, on these so that we can expand the utilization. For now, for aging skin, the topical application, we're using Quantificare 3D measurements where we can measure wrinkles, measure pores, overall evenness of skin,
objective.
and make it more objective. So uniformly, I published a paper 2 years ago now on exosomes with aging skin. And uniformly, that too was a double-blinded saline placebo control. Uniformly in the exosome patient population, we saw an improvement in the tone, quality, clarity of skin with a consistent reduction in wrinkles, pores, increased evenness, and even in melasma patients, we see decreased pigmentation and increased vascularity. Yes.
Okay, so exosomes, cellular level, facelifts have gone from skin-only facelifts to fascia and skin, SMAS, sub-SMAS, now deep plane. There were subperiosteal, they came back up a little bit. So we keep getting deeper, and now we're getting from the skin into the actual cells, deeper and smaller and better. But what else is there? What else do you recommend for
We've also
results?
been working for the last 5 years. Dr. Nathan Bryan is a PhD from University of Texas, who is a world leader in nitric oxide. Nitric oxide is developed in our own endothelial cells as well as our oral mucosa. It's a gas in our body that is involved in most enzymatic reactions in the body. In fact, all of the people we know now that gas exchange in the lungs and with hemoglobin is a 3-gas oxygen, carbon dioxide, and nitric oxide. All of the COVID patients that were dying on 100% oxygen intubated were dying because they were nitric oxide depleted. So we put all of our patients now, you can get oral nitric oxide lozenges. So they're great for heart health.
So this is a gas as a pill.
Correct. A lozenge you chew up as it's dissolving in your mouth, it's releasing nitric oxide. Plus now we have a nitric oxide releasing serum. It's a dual chamber serum. One side is vitamin C, the other side is sodium nitrite. When you mix the two together, it forms the gas nitric oxide. So when you apply it, we've been using it in hospitals to get hard-to-get IVs. You get potent vasodilation with it, and so it also acts as a vehicle for enhanced absorption of whatever our patients are utilizing. So and so we use that as well in conjunction with exosomes. It's become with more people injecting injectable fillers, we're seeing more vascular incidence. So combining topical exosomes with topical nitric oxide is a vascular occlusion incident rescue that now is that we're adding to hyaluronidase as well.
Amazing. There are so many exciting things coming between cellular medicine, exosomes, nitric oxide, verteporphyrin, scarless healing. The future is very, very bright for what we can do and offer people so they live their best life. People who want to get in touch with you, how do they do that?
They can go to our website, drchernoff.com. They can email me at greg@drchernoff.com. I'm always happy to share, as you have always been so generous in doing so, what we know and what we've learned.
Well, thank you, and thank you for listening to Plastic Surgery Secrets Talk. If you liked what you heard, listen to all the other episodes available on your favorite podcast provider. If you want for more information about the Spiegel Center in Newton, Massachusetts, reach out to us at info@drspiegel.com. That's DRSPIEGEL. And thanks again to Dr. Chernoff from here in Miami, Florida.